Mr. Speaker, there are continuing concerns over the lack of sufficient change in Manitoba's emergency rooms since Brian Sinclair died. Today, CBC has exposed concerns that very unfortunate forms of discrimination have existed in our emergency rooms. Common use of terms like not bedworthy may be fading, but in critical matters of emergency health care, any delay in care or treatment resulting from discrimination can result in death. What assurances can the Minister of Health provide to all Manitobans that the ugly emergency room culture described by the CBC has changed to treat all people with equal respect, dignity, and access to treatment?
I thank the member for the question. Use of those terms that he's put on the record are completely unacceptable. We do not in any way endorse them. We actually think they're very inappropriate. This is part of the culture we're trying to create in Manitoba, not only with Bill 18, but across all of our schools, institutions, and public institutions, that all people should be treated with respect, that diversity should be respected. This is part of the professional training that's being offered to nurses and other healthcare professionals who work in a variety of institutions across Manitoba. They do get professional development. Professional development does focus on not only the technical parts of doing their job, but the human relations part of doing their job, and the respect for diversity and the respect for human rights. These are fundamental things that need to be done in all jurisdictions here in Manitoba. The member will know that we've amended the Human Rights Act to address issues of social differences in Manitoba. That legislation gives a wider ambit to consider any concerns. But the most important thing to do is to do the training and to help people understand the conditions that people come into the emergency rooms with, their history, their background, their culture, their language. And with that kind of knowledge, they can be more helpful and more empowering of those patients to meet their needs.
Mr. Speaker, for 7 years, the Minister of Health has said that she's been improving our emergency rooms. And yet today, CBC tells the story of Rob Corshane, an Aboriginal amputee in a wheelchair with a bladder infection who had to wait 7 hours in order to be catheterized. 5 years after Brian Sinclair, and only just a few weeks ago, Mr. Corshane's story sounds far too similar to that of Mr. Sinclair. Mr. Corshane grew sicker and sicker before he finally got attention. The Premier has time and time again failed to act. I asked the Premier, when will he ask his Minister of Health to resign and replace her with a minister who can make sure our emergency rooms are working properly?
Mr. Speaker, any incident such as the member described is obviously something nobody in this House wants to happen to any patient coming into our system, which is why we, in the very early days, made very significant investments in emergency rooms all across Manitoba to improve their capacity, which is why we put extra resources in place for emergency room physicians, which is why we put extra resources in place for triage nurses to do assessments and to do follow-ups on that. All of these things have been done to improve emergency room operation. In addition, to take pressure off emergency rooms, we've innovated with quick care clinics around Manitoba, so the people that have non-absolutely urgent needs can go and get a service on an extended hour basis throughout the province of Manitoba. So quick care clinics, better training, more support for emergency rooms. These have all been measures we've taken. Is it perfect? No, it is not. And unfortunately, some incidents happen. But where they happen, they're investigated. Solutions are looked for, corrective measures are taken, and the system acknowledges responsibility and addresses those concerns so that they can't happen again. And this is the kind of culture we want to create, a culture of accountability, responsibility, and constant change to improve the quality of service in our institutions.
Order, please. The first minister's time is expired.
Mr. Speaker, when I called for the Minister of Health's resignation yesterday, her smug response was, and I quote, "That was cheerful." Mr. Speaker, Manitobans, like family members of Brian Sinclair and others who've had problems in the emergency rooms, deserve better than comments like a petty joke.
No question.
Manitobans have been patient with this government. We have waited not 34 hours, but 14 years for the improvements we should have to our emergency rooms. And they are still not where they need to be.
Not even close.
When will the Premier replace this minister with someone who can do the job and get our emergency rooms working properly?
Mr. Speaker, not only have there been additional resources put into emergency rooms in terms of triage nurses, in terms of a patient advocate, in terms of the availability of interpreter services, and additional support to attract and train and have ER physicians available on a regular basis, 7 days a week in many cases. But the WRHA takes their responsibilities very seriously, and we are very supportive of them. This Minister of Health is considered one of the best ministers of health in the country. The practices we have put in place have been copied in other jurisdictions in Canada. They've come to us to learn from them. We have never said they're perfect. We do not like to see any of these incidents occur, but where they occur, we do everything we can to ensure that they do not occur again. And that is exactly the culture we need. We need a culture of constant learning and accountability to ensure these things don't happen again. And it starts with the quality of professional training and ongoing professional development that we have for all the people that work in these systems. Many of them work under high degrees of stress. They work shift work. They work with very challenging situations coming into their door. They need the support. They need the respect necessary to ensure that they can do that work. And I can tell you, the across-the-board cuts the members opposite were proposing would not make any of these situations better, only worse, Mr. Speaker.